Good morning, good afternoon, good evening. Thank you so much for joining us today. Really excited to have so many people from all over the globe joining us for the next webinar, the sixth in our series on men, cancer, and HPV. My name's Tim Shand. I'm the policy consultant at Global Action on Men's Health, and we're thrilled, together with our partner NOMAN as an island, Race to End HPV, to put on this webinar today, which will focus specifically on the really important issue of advocacy for policy change. Let me begin with some housekeeping. Please do sign in. I see that some of you have already done so. We'd love to know your name, your organization, where you're coming from. Please do use the Q&A box in Zoom to post questions. You can also use the chat box for comments and thoughts, but it's helpful for us if you can direct your questions to the Q&A box. This is an interactive webinar. We really want to hear not only your questions, but also your thoughts and experience on HPV advocacy. So please do take part. And as it says at the bottom of the screen here, we're recording this. Many people like to listen back on this webinar, and others who can't be here today are also able to watch later. So it's really helpful to do that. So why are we discussing this very important topic? So currently, no low-income countries vaccinate boys for HPV, only girls. And despite many middle and the majority of high-income countries being committed to routine universal gender-neutral HPV vaccination, progress on that is slow. And many people, as a result, are dying unnecessarily. We have exciting recent developments that help to make the case for expanding routine universal vaccination, the importance of vaccinating boys as well as girls. Last December, the UN Political Declaration on NCDs and Mental Health included a call for boys' HPV vaccination, the first time a UN document has ever done so. Also last year, the European Code Against Cancer was revised and now recommends vaccinating both boys and girls. And the Pan American Health Organization for some time has been committed to this approach. So now it's time for these commitments to lead for action. And advocacy can play a really important part in achieving this change. Advocacy can cut through the inertia and help to push politicians and policymakers to make the right decision. We realize that the advocacy experiences that we're going to share with you today are very context specific. What works in one location and one part of the world may not necessarily fully apply in other contexts, but there are lessons and experiences which we think are universal. And of course, you will need to adapt what you hear today to your own particular realities and challenges as well as opportunities. And that's why we're really keen to hear from you in this webinar. What's your experiences in learning? How, more importantly, can we support your HPV advocacy to encourage more countries to vaccinate boys as well as girls, not only to end cervical cancer, but to end all the HPV cancers and diseases? So we have a fabulous panel who are going to share their advocacy experiences with us today. We have David Winterflood, who is the director of NOMAN as an island race to end HPV. We have Associate Professor Momchil Baev from the Astra Forum Foundation and the new Bulgarian University. We have Jane Tsai, the Vice CEO of the Formosa Cancer Foundation in Taiwan. And finally, we have my colleague Peter Baker, the Chief Executive of Global Action on Men's Health. Before we begin, I want to thank our sponsors. Global Action on Men's Health work on men, cancer and HPV is generously supported by a grant from MSD and from our colleagues at NOMAN as an island race to end HPV. So it gives me great pleasure to introduce David. First, David is going to speak to us about the successful HPV gender-neutral vaccination campaign in the UK. David, over to you.
Thanks, Tim. I'm just sharing my slides now. Can I just ask Is that on presenter view or can you see the slides themselves?
No, it's currently presenter view.
Okay, how about now?
Yeah, perfect.
Great. Well, thanks everyone. Hello. Thank you for taking the time to join us. It's something quite nice about stepping back into the time machine to talk to you about the HPV Action Campaign, which began in 2013 and was ultimately successful in advocating for a change in policy in the United Kingdom to extend HPV vaccination to boys. And when we start with that journey, I thought it would be helpful to give a bit of background about how we operated. So HPV Action is a coalition of patient and professional organisations from across the UK advocating for the inclusion of boys in HPV vaccination programmes. Began with 2 organisations and grew from there. The membership was very broad and deliberately inclusive, ranging across cancer, sexual health, men's health, gay men's health, public health, oral health, from small local groups to large national bodies. And in total, 51 organisations joined the coalition over the course of the campaign. And that breadth gave us credibility and access to a wide range of evidence and perspectives. The organisation, the coalition, was funded almost entirely by its own members. No funding came from vaccine manufacturers or any organisation with a commercial interest. The entire 5-year campaign cost around £60,000 or about 75,000 sterling if pro bono contributions are included. And in a way, that lack of external funding was actually a major strength because meant there was no accusations of conflict of interest, which mattered hugely in the United Kingdom in a highly scrutinised policy space. And in addition, it kept us focused on what activities would move the needle. The organisation itself was deliberately small and lean, rather. There was no formal structure, but strong governance. Overheads were minimal. A small working group was established throughout. And that meant we could make decisions quickly when needed and kept the campaign agile. We also secured support from influential individuals. So the BMA, the British Medical Association, adopted a policy supporting vaccination for boys in 2014. Professor Margaret Stanley was a key clinical voice, and Professor Giampiero Favato provided crucial expertise in challenging cost-effective modelling at meetings with Public Health England and the Joint Committee on Vaccination and Immunisation. That's the NITAG in the UK. And finally, the goal was always really simple and clear: HPV vaccination for boys. And that clarity kept us focused in our actions over time. In terms of our tactics, we use 3 main tactical strands. Firstly, influencing professional opinion. So we made the case to opinion leaders through evidence-based articles in professional journals for school nurses, dentists, public health specialists. There are also papers in scientific and medical journals, alongside conference and seminar presentations. At the same time, HPV Action engaged directly with JCVI through consultation submissions, correspondence, and meetings. And by 2018, 5 years in, there was a growing professional consensus that gender-neutral or routine universal vaccination would benefit public health. And throughout, we consistently argued that JCVI's approach to cost-effectiveness on vaccinating boys was flawed, and I'll come to that later. Secondly, political engagement across all parties. Politicians from all major parties in the United Kingdom were engaged through correspondence, PQs or parliamentary questions, and debates. And we also gained the support of 2 key all-party parliamentary groups that we have in the UK. One was the APPG on cancer, and the other was the APPG on dentistry. So cancer and dentistry, 2 great communities that we could draw on as supporters of it. In addition, a parliamentary debate in May 2018 proved especially important. It took place just weeks before the JCVI's meeting, and it was initiated by a senior government MP with strong backing from across all political parties. And then thirdly, working with the media, we developed stories that created new angles, including support from Nobel Prize winner Professor Harold Suhausen, who people may know his role in the vaccine, a national survey of dentists and doctors conducted with professional bodies. Within that, 95% of respondents to that survey supported vaccinating boys. And most significantly, was support from a major national newspaper, the Mail on Sunday, which ran a series of hard-hitting articles in early 2018. And its readership profile is particularly influential with government decision makers. And this was combined with legal action pursued by one of our organisations around the process and policy of protecting boys. So together, that was incredibly impactful. Now, what didn't go well? It wasn't without difficulties. Money was very tight. A small number of members carried most of the financial burden. This limited our public engagement. Petitions failed to gain traction. Wider grassroots campaigning was constrained. And as with any coalition, there were disagreements on tactics, and debate around that sometimes led to delays in actions. Equally, some large charities chose not to support vaccinating boys until the policy decision was announced, despite the potential impact of their support. And we also failed to push early enough on issues such as a catch-up program for boys, assuming that a boys' vaccination program would simply mirror the girls' program, and ultimately it didn't. And in terms of one of the key learnings, what I would say to others that are on this call is that making the financial case for vaccination is so important, because politicians are influenced by healthcare cost arguments. And in terms of human papillomavirus, it presents a unique challenge for economic evaluation, because infection occurs very early, but disease may develop decades later, and many life years can be lost. And that makes assessments highly sensitive to the discount rate that's applied to future benefits. I don't have that much time to talk to you all about discount rates, but put very simply, a discount rate affects how we value benefits today versus those that benefit far in the future. So for HPV vaccination, almost all the benefits preventing cancer and saving lives happen decades after vaccination. And at the standard 3.5% discount rate used in economic models, those future benefits get heavily marked down. So the vaccine looks less cost effective. However, when a lower 1.5% rate is used, which is allowed in the UK for long-term life-saving interventions, those future benefits keep their weight. And under standard methodology used by the NITAG, aligned with NICE, which we have here in the UK, which is the National Institute for Health and Care Excellence, guidance at a 3.5% discount rate said that gender-neutral vaccination appeared not to be cost-effective. However, NICE allows a 1.5 discount rate, and when that is used, JCVI ultimately accepted that this lower rate not only could apply to HPV vaccination, it made gender-neutral vaccination likely to be cost-effective at a realistic price to dose, because we recognise that the long-term life-saving benefits extend beyond 30 years. So in terms of final tips then, just to sum up, a campaign and our campaign for securing jabs for the boys. Change doesn't happen overnight. It took us 5 years, 6 by the time the policy was implemented. Keep your goals specific. Build a broad alliance of organisations, any organisation that might be touched by this issue. Make the financial case, not just the moral one. Engage politicians across all parties, and use the media to build pressure and momentum. Good luck, and please do share any information around any campaigns that you're working on, because we'd love to hear about them.
Thanks so much, David, and appreciate you keeping to time. Also, so many helpful tips there that I think we can take away. Particularly, what stood out for me was the importance of being focused and the importance of making the financial case. But very helpful lessons indeed, and congratulations to you and everyone involved in that successful advocacy in the UK. A reminder, please, to keep your questions and thoughts coming in the chat and in the Q&A box. I'm now pleased that we will have a video from Jane Tsai, who will share the experience in Taiwan on GMV advocacy.
Hello, everyone. My name is Tsai, the Vice CEO of the Formosa Cancer Foundation. Taiwan has offered free HPV vaccination for junior high school girls since 2018. In this September, free HPV vaccination program extended to junior high school boys as well. This makes Taiwan become the first country to implement GMV policy in the East Asia. We are very proud of the program and would like to share some experiences on our advocacy efforts. Taiwan adopted gender-neutral HPV vaccination was driven by combination approaches. In terms of scientific evidence, medical associations and societies consensus, clinicians support, legislators support, gender equity values, media attention, and international experience of UK and Australia, and also the patient groups' continual advocacy efforts is very important. Patients' voices cannot act alone, and they play a crucial role on a hard push of GME policy. The Formosa Cancer Foundation amplified clinical evidence and cost-effectiveness data to turn science into the actionable policy initiative. The information of consensus from medical society can provide a very strong academic support and has a significant influence on policy development. So we brought together the Director of Health Promotion Administration, which is the decision maker, public health researchers, experts from various specialties such as gynecology, pediatrics, to hold a series of experts forum and summit during 2019 to 2022, the 4 consecutive years to build a consensus on GMV policy. In 2022, 8 major medical societies and associations were invited to publish the position statement on GMV strategic consensus. Also, the consensus reached in the forum and summit was compiled into the policy proposal and was submitted to the Health Promotion Administration as an important reference for policy development. In 2019, the Formosa Cancer Foundation launched the HPV-friendly clinic to invite the various HPV-related specialties such as gynecology, family medicine, urology, pediatrics, and otolaryngology to join in. We provided a clear and visible logo in the clinic for people to easily identify. We utilized location-based services provided by mobile phone companies plus GPS to show the location of nearby HPV clinics, provided HPV health education materials and communication tools to enhance the interaction between the healthcare professionals and the clients. We also held annual continuing medical education courses for healthcare professionals to continually update their knowledge and understanding of the value of HPV vaccination. In order to increase the awareness of the importance of HPV vaccination, we adopted several innovative approaches, such as we invited the famous YouTubers as the HPV awareness campaign ambassador to encourage youth to get the shot to protect themselves. And we also made humorous videos in Facebook, Instagram, YouTube to attract young people's attention to spread the HPV prevention message through the peers' influence. And we invited the key opinion leaders and the social media influencers to call on taking action. We also collaborate with the hip-hop artists to help youth understand the HPV vaccine. And since Dcard in Taiwan is the most favorite networking platform. It's very useful to talk about HPV prevention and vaccination. It's an open and popular topic to spread the correct message. In 2024, several legislators held press conference at the Legislative Yuan to call on the government to support the GMV policy. And we also held the national tour lectures for parents and junior high school students to highlight the importance of both gender vaccination as well as enhance the competence on vaccine safety. We also produced 3 short videos to deliver HPV prevention concept for junior high school students. The Formosa Cancer Foundation transformed HPV vaccination from a woman's issue into a national equity and cancer prevention movement to successfully achieve GMV policy in Taiwan. The GMV policy is not merely a matter of vaccination. It represents gender equality and healthcare equity because we believe every child, regardless of gender, deserves the same level of protection and should have the same opportunity to prevent HPV-related disease and cancer. So together, we can make HPV-related cancer and disease a thing of the past.
With our huge thanks to Jane and our colleagues at the Formosa Cancer Foundation for that video, and our congratulations to them on their successes. Thank you very much, colleagues in Taiwan, for sharing that with us. I'm very pleased now. It's my great pleasure that I can introduce or hand over to Associate Professor Momchil Baev, who will talk to us about the work and achievements of the HPV Coalition in Bulgaria. While Momchil is getting ready and sharing his screen, just a reminder again about questions. We've already had a couple. Thank you. And please do keep your comments going in the chat. Momchil, over to you.
Hello, Tim and everyone. Great to be together and be part of this lovely series of webinars, especially dedicated to men, HPV, and cancer. Let me just pull up my presentation right here. There we go. I will briefly present to you all the path that the Bulgarian activists and HPV coalition went through in the past 3 years or so. As the HPV coalition was established in the beginning of 2023, we've come a long way in achieving some major successes, which you will see right now. This is a brief timeline for the first part of our work. Like I mentioned, in March 2023, the HPV coalition was officially launched with a number of relevant stakeholders and medical professionals, NGO representatives, and other experts who were keen to work on better access to HPV vaccination and screening in Bulgaria. Soon after that, we held the first Academy for Journalists. There were some 15 health working journalists from Bulgarian media who took part in this in-depth training workshop on HPV communication and significance. That was a good opportunity to get them more acknowledged with the topic, how they can speak more properly about vaccination, how to talk to broader audiences. Then the coalition launched an HPV awareness campaign. It was a communication campaign targeted at the wider public, and it used also influencers. Later on, we took some advocacy initiatives and gathered an evidence-based scientific literature review covering a number of data that supports gender-neutral HPV vaccination. We wanted to present the Ministry of Health and the Ministry of Finance with this information to encourage them to invest more in prevention rather than in treatment later in life. Soon after that, in November, the same year, 2024, the health minister at this time announced at a large conference that boys will be at last included in the national HPV prevention program. In other words, they will have access to free of charge vaccination, which was a major milestone for us. The Ministry of Health itself also started a screening campaign with communication campaign combined to reach out to tens of thousands of women. This was the only group targeted by the Ministry of Health at this time. However, that campaign later expanded to include general population, including men and boys. Of course, the work of the HPV Coalition has been part of beautiful partnerships, and none of our successes would have been possible without the partnership with friends and colleagues. And it's very important to mention the European Cancer Organization that has worked very closely with Bulgaria for 2 years between 2023 2025. At this time, I was also a consultant for the cancer organization in Bulgaria on HPV, but there were also other focal groups and consultants in neighboring countries like Romania, also Croatia, and other countries in Europe. So that allowed the Bulgarian HPV Coalition to be part of a broader pan-European network that gave us a stronger voice. And of course, we took initiative in organizing several advocacy events across the region, including in Bulgaria. I will show you a few slides about that in a minute. So we turned HPV vaccination and screening into a cancer prevention in the public narrative in Bulgaria. Just to mention a few of the HPV coalition public events and work with influencers. There was this event called Mailbox for Fairy Tales. It involves writers, influencers, public figures, just famous celebrities from Bulgaria who came up on stage and read stories related to HPV, cancer, and vaccination. It was a very inspiring event. It brought together so many people from the show business, from the general public, and of course, among the guests, we had people from the Ministry of Health and the European Cancer Organization, the CEO at this time, Mr. Mike Morrissey. The Advocacy for Change has different approaches. Of course, major part of our work was direct communication with journalists. These are a few pictures from this Academy for Journalists that took place first in 2023 and a second time in 2024, with the goal to create an information engine of change. We applied the method of World Cafe, which was used for the first time to train health journalists in Bulgaria. That allowed for more in-depth communication, small groups, like in a workshop, had the opportunity to work with specialists and develop their own communication campaign that was later on presented in the media. On a policy level, we had a couple of major events that took place in Bulgaria. The first one was a roundtable at the Bulgarian Parliament in early 2024. That was, of course, in partnership with the European Cancer Organization, and it was the national launch of Time to Accelerate Together Against Cancer for Bulgaria. We brought together politicians from the entire spectrum in the Bulgarian Parliament, We reached a broad public awareness. There was a lot of media coverage, a lot of social work, social media contents created, and it really did stir debate in the public. We, of course, placed this topic in the context of the European Beating Cancer Plan and the Bulgarian Cancer Prevention Plan, which is still to be further developed. The other high-level policy event took place in early 2025 in January. That was the first East European Conference on HPV elimination. That was again together with European Cancer Organization and the Bulgarian Parliament, group of politicians, again, all of them from the whole spectrum in the political parties and the parliament. The conference brought together key opinion leaders from Bulgaria, Romania, Croatia, North Macedonia, Serbia, Bosnia and Herzegovina, Montenegro, Albania, and Kosovo. There were a number of professionals, medical workers, government institutions and stakeholders, NGO representatives, you name it. The conference concluded with a declaration that was signed with all the participants and politicians. The declaration is available with the QR code. Any of our viewers today can scan the QR code and see the declaration and support it, endorse it. These are a few pictures from the same event. Of course, you can see the level and the scale of this work that we've carried. So many people spoke about the topic in a way that really encouraged the Ministry of Health to take the last step and launch a new national HPV prevention program that includes boys as well as girls. This is just a slide borrowed from the Ministry of Health. I just want to show you what the vaccination coverage rate was before the campaign started and before the HPV coalition was launched. The target group for the vaccination campaign were only girls at the age between 10 and 13 years old, and it was girls only. You can see the percentages here on the slide. It was very low. In 2022, 1%, 2023, 1.5%. And suddenly, since 2024, the percentages started going up. And to the point where in 2026, we already have this a new national program that was adopted last year and included free vaccination for girls in the age group of 10 to 17 years included, but also boys between the ages of 10 and 13 years included. Only in 2025, as per data from the Ministry of Health just recently, 14,000 girls vaccinated and 4,000 boys got their shot. So that's a major accomplishment for us. It's a collective effort for so many people from the HPV coalition and the institutions who were strongly encouraged by the professional community to step up. Coming to a close of my presentation, I'd like to give you just an overview of the major steps any group of activists can undertake in their country to succeed in better efforts to make gender neutral vaccination for HPV. Bring together like-minded professionals, create a coalition, gather experts from different fields. Diversity is important here. Doctors, nurses, midwives, NGO representatives, public health experts, policymakers, influencers, and journalists. Create a strategy and goals of your coalition. Know your environment. Do a mapping of other stakeholders and interested parties. Of course, very importantly, create data, do research and surveys. We've done a few research papers in Bulgaria, Romania, and Croatia, together with partners who are participating here today. And data speaks a lot, especially to institutions. They need data to base their decisions on. Don't forget the online presence, social media strategy, work with media, interviews, articles, speak anywhere possible in different forums and conferences. Attract some influencers to support the cause. And importantly, engage policymakers and politicians. Among them, you can find champions to carry the ideas further. And also participate in scientific and policy conferences to reach out to the broader scientific community. And of course, engage with the general public because those are the minds and hearts we need to win when it comes to vaccination. And lastly, be ready to answer all questions coming from different sources. And with this, I thank you for your attention. I'll be happy to have a discussion afterwards.
Momchil, thank you so much and congratulations to you, and so many important lessons for us all from that, and not least the importance of data as you kind of reinforced at the end. So thank you so much. And talking about data, just to thank you all for many of your comments. It's great. Andrea Joe from Cameroon has mentioned in the chat about the fact that they have published, their Ministry of Health in Cameroon has published a scientific a cost effectiveness analysis of gender neutral vaccination, which is great, and we love to see that, Andreas, and many other comments that are being made. So excited about the discussion we're about to have. Can I turn finally to my colleague Peter Baker from Global Action on Men's Health, who will talk to us about ECO's practical guides on advocacy for HPV policy change. The floor is yours, Peter.
Thank you. Can I check that you can see my slides okay?
Yeah.
Yeah, great. Thank you very much. And hello, everybody. And it's a pleasure to be with you. I'm going today to talk about a report that I was asked to write by the European Cancer Organization a couple of years ago. It's basically a practical guide to advocacy for HPV policy change. And you can see there the front cover of the report, the guide on your screen, and there's a link there as well if you want to take a look at it. It's free to download, and we'll also put the link in the chat. I have to at this point say a big thank you to ECO, European Cancer Organization, for all the work it's done on and continues to do on HPV. And Momchil has already mentioned this, but ECO played a leading role in influencing the content of the Beating Cancer Plan, which is the European Union's policy on cancer. And ECO was instrumental in getting gender neutral or universal vaccination included in that plan. And that has led over the last few years to all 27 members of the European Union now introducing gender neutral or universal HPV vaccination. And that really is a huge leap forward over just a few years in Europe. So what is this practical guide, this advocacy guide all about? Well, what ECO did was to invite 11 organizations based in Europe who had been involved in advocacy work on HPV policy to come to a facilitated one-day workshop in Brussels in January 2024. And both David and Momchil were among those who participated in the meeting. So as I said, the workshop was organised and led by the European Cancer Organization, and the discussion was recorded, transcribed, and the content analysed by ECO, by myself. And the key ingredients of effective advocacy were identified and shared in the report. And the content of the report was checked with the workshop participants before publication. So what we did through the discussion on the day and the analysis in the report was identify 8 essential ingredients of effective HPV advocacy. And as Tim said at the start, these may not apply to every country or every context, but nevertheless, we think there is some value here in many of the ideas that were identified, and there should be some that are universally applicable. I should say at the outset that all the advocacy campaigns in Europe that we looked at or who took part in the discussion were based on a coalition type approach, bringing organisations together in a partnership to work collectively towards a goal around HPV advocacy. So the first step, the first essential ingredient, is a pretty obvious one: to identify the problem. And clearly what we need to know when embarking on a campaign, well, what is the scale of the problem we're dealing with? What is the incidence and mortality rate for all the cancers caused by HPV in both men and women? Now, that data may not be available or easily available in every country, but if it's not, there may be neighbouring countries which are similar, which do have data that can be drawn on. And it is useful where there is data in a country to compare it with what's going on in neighbouring or similar countries or to the region as a whole. Obviously it can help in terms of a campaign if your country is doing worse than one nearby, because it really makes the case for action in your country, makes it even more pressing. The second step is to recruit partners. And it's important to know which organisations and individuals would add value to the campaign as a partner. And clearly, in many ways, it makes sense to recruit as many partners and sponsors, and not sponsors, but partners and supporters as possible. There's obviously strength in numbers. But on the other hand, having too many can create difficulties in terms of management and coordination. So be mindful of not trying to recruit everybody, but set a target perhaps for a number that is workable and manageable. Think about how best to recruit partners. In many cases, an email may be enough, or an online meeting, or it may be worth having a face-to-face meeting to really discuss the issues in more detail. And that may be particularly useful for organisations that you especially want on board, that will be especially useful to the campaign. Also worth bearing in mind whether any of the partners come with baggage or create potential conflicts of interest that could undermine the campaign's credibility. And generally speaking, if a partner has a commercial interest in the outcome of the campaign, that may make life a bit more complicated, and you may wish to avoid that kind of relationship. It's important to get the governance right to decide whether the campaign has a legal identity or not. Does it, for example, form itself as an NGO registered with whatever the system is in your country? It's important also to decide how decisions will be made by the campaign. It's important that partners feel that they're involved in decision making, and to know what kind of decisions or strategic decisions they need to be or will be involved in. So the roles and responsibilities of the campaign's partners need to be set out, as should the roles of any executive committee or people in a leadership position. Decide on goals and objectives. So clearly you need to know what you're trying to achieve and how many goals and objectives you will have. As David said, having one in the case of the campaign in the UK, which I was also involved in, it can be helpful to have maybe just one or a couple of goals and objectives to stay as focused as possible, but to make sure that any goals are smart, specific, measurable, achievable, realistic, and time related. It can be tempting in a campaign to set all sorts of objectives, to kind of go for gold, try and achieve everything at once. But often that can be a case of biting off more than you can chew, and the whole campaign could become unmanageable. And it's very important that any goals and objectives are agreed by all the campaign's founding partners and signed up to by subsequent partners. Everybody has to be agreed on what the goals and objectives are. It's useful to analyse the policy landscape, to know, for example, what other key policy issues in your country can be aligned with action on HPV. So how does action on HPV align with cancer policy, for example, or sexual health policy, or perhaps policy on equity and equality in health? And as both David and Momchil and Jane pointed out, it's important to address the financial issues to reassure politicians that improving vaccination or screening services in the case of cervical cancer will ultimately be an investment rather than a cost. If politicians are convinced that they will actually ultimately save money by investing in policy change on HPV, they're more likely to decide to go for it. Develop your own strategy and budget. So you almost certainly won't have unlimited resources. So how can you make the biggest impact with the resources that you've got? And what are the most effective ways of engaging the key target audiences? So clearly, in the case in Bulgaria, journalists were one of the key target audiences. In the UK, politicians were one of the key audiences. So how can you engage with them most effectively? Whether that's with one-to-one meetings, or perhaps in the case of politicians in Parliament, with meetings with political groups and perhaps MPs who are interested in a particular issue. Obviously, you need to take action. Everything I said up till now is about preparing to take action. Then you have to do it. And it's important that the partners understand the action plan, including what they need to do and when. And it's also important there's a system for recording and reporting on the actions that are taken. And finally, monitor and evaluate. So have a set of criteria against which success can be measured, so you know when you're actually achieving your goals. And to think about how an evaluation can be shared with partners and a wider audience. And that's certainly valuable at the end of a campaign, whether it's been successful or not, so other people can learn from it. But it's also useful to have an evaluation during a campaign, so you can see what adjustments you might need to make and what changes you may need to make to your tactics and perhaps the wider strategy. So those are the 8 key ingredients. Just finally, I'll end with a quote from the practice guide. Advocacy on HPV policy is now more than just a good idea. As the ECO guide demonstrates, there is now solid evidence from campaigns across Europe that shows that advocacy can really work and result in less suffering and more lives saved. Thank you very much.
Peter, thanks so much, and such a valuable resource that I would encourage all of you to take a look at, and so many lessons that are applicable across the globe. If I could just invite the speakers now to come back online. There's a couple of questions that I'm going to share with you, and before I would like to get low and middle income country context in quickly, but I think 4 things for you as speakers to think about. I think there is just a really important question from Agnes and from others around LMIC contexts and how in particular we can help to strengthen the advocacy around HPV vaccination for boys in those contexts. Interesting questions about vaccine hesitancy, not only the challenge of vaccine hesitancy itself, but in particular, I think from Tina in Nigeria around, the challenge of vaccine hesitancy when you only vaccinate girls, and perhaps vaccinating boys may be an opportunity to address some vaccine hesitancy. We'd love your thoughts on that. Thirdly, a question also from Agnes around entry points for HPV, whether school-based or facility-based may be best as you think about your advocacy. And I don't know, Momchil and others, if there's any reflections you can give on that. And then lastly, a point from Cohen in around LGBT advocates and the importance of engaging LGBT advocates, given that LGBT communities are certainly not covered, as we know, sufficiently or at all, arguably, from girls-only vaccination, and often very poorly covered when there is boys vaccination as well. So those are 4 things for you to quickly think about. I would like to very quickly give the floor to Salom Meyer from Cameroon. Cameroon has done some really impressive advocacy around HPV policy change in their context. And I just, Salom, would like to give you just a couple of minutes, if I may, just 2 minutes, just to share very quickly on your experiences and any top tips that you've got as we think about the important challenge of low and middle income contexts for policy advocacy. Salom, you'll need to unmute yourself.
I think I am unmuted, and just to correct.
You are, yeah.
Yeah, just a correction. I'm not from Cameroon. I'm actually from South Africa. However, I am aware of Cameroon's excellent work that they have done with regards to advocacy to include gender neutral vaccination. from 2023, and that is because of ACHA, African Cervical Health Alliance, which is an alliance that is promoting cervical cancer or the elimination of cervical cancer. However, I can also share with you with regards to low middle income countries in Africa. We've recently, and thank you, Tim, you have shared our policy brief that we published last year. We, the Cancer Alliance, together with a number of collaborators, developed a policy brief for government, for our policymakers, on why we think that moving towards gender-neutral vaccination is indeed the best buy for South Africa, and specifically, and I think from a human rights perspective, and one of your last statements, you were talking about the LGBTQ community. South Africa, very, very distinctly, we do not discriminate in our country according to our constitution. So we're also using that as a tagline and saying, so why are we now discriminating against boys and against our communities? So we need to start considering gender-neutral vaccination to cover boys and girls, especially in a community or a country where HIV incidence is high, and we have an increased rate in penile, anal, and cancers of vulva, as well as oropharyngeal cancers. And those are the very particular reasons why we actually have motivated in our policy brief for gender-neutral vaccination. Thank you.
Salom, thank you. And yes, you are indeed from South Africa, sorry. And thanks for everything that you do and your colleagues do to advance this issue. So let me turn, I see Peter first on my screen. I'll take you first, Peter, your responses on any of those questions, and then Momchil, and then David.
Okay, well, I don't think I'll attempt to answer all of them in one go, but I'll have a stab at a couple of them. I think it was a very interesting question about whether vaccinating boys can help to tackle vaccine hesitancy. And I think there's some evidence, I don't think it's conclusive, but there's some evidence, certainly from Cameroon and elsewhere, that if you do extend a vaccination program to include boys, then that can help to overcome certain aspects of vaccine hesitancy. It can be reassuring to parents in particular that the vaccine is safe. So in Cameroon, we did see an increase in vaccination uptake once the program was extended to boys. I mean, one of the arguments that, one of the concerns that, one of the pieces of disinformation that's out there is that vaccinating the HPV vaccine can cause infertility in girls. And I think that vaccinating boys can provide some reassurance that this is not just some kind of conspiracy aimed at girls. Another question was about school-based or facility-based vaccination. And I think there's a pretty good consensus now that, generally speaking, school-based programs have the biggest reach. They result in higher levels of uptake, perhaps for obvious reasons, because they eliminate many of the barriers that exist if you have to make an appointment to go to a facility to have your vaccination. If the school nurse can deliver the vaccine at school to a, as it were, a captive population, then you're more likely to get increased rates of uptake. I'm not sure that's true everywhere. In Portugal, for example, there's a very successful, very high level of uptake of HPV vaccination, and I think there you have to go to a facility. But that's a bit of an outlier. Generally speaking, school-based programs do have the highest levels of uptake. So I'll pass over to my colleagues, perhaps, for some of the other questions.
Great. And it'd be great, Momchil or David, if you can pick up the LGBT question also. Momchil, over to you.
Thank you, Tim. I'm glad Cohen Verbeek brought up the LGBTQ plus community question. Indeed, we haven't talked about it today much. In my experience, the LGBT community, at least in Bulgaria, is very much aware about HPV and the risk it imposes on, especially on men. And it seems like men are seeking vaccine proactively, men in the community, even if they're not specific targets in national campaigning or in the national HPV prevention program, men in the community seek the vaccine, they ask questions, but we have to admit that there has not been any particularly directed campaign at the LGBTQ plus community, and that's something we're lacking because men and cancers is an important topic for the community, and we need to do more. So that's probably something we should take up, and it's a good idea for the year ahead of us to do more in that topic. In terms, if you allow me to comment also on the school-based vaccination programs, many countries in Europe have those and beyond. Bulgaria used to have school-based vaccination programs decades ago. They were very successful. Vaccination coverage rate was very high. It's still high, but we're lacking in different regimens here and there. There was a major healthcare reform in Bulgaria a couple of decades ago when school-based vaccination programs were ceased to exist and they were transferred to the ambulatory care at healthcare facility. That would be the general practitioners, family doctors, also known as. And no school-based vaccination programs existed present, but that would be very successful. I just recently read the case of France, where school-based vaccination is working, probably many other countries as well, and the results they're achieving are amazing. There are countries that are doing so good in HPV vaccination coverage rate that it's amazing. Even neighboring North Macedonia, neighboring to Bulgaria, they have some 60% vaccination coverage rate for HPV alone, and Bulgaria sits around 4 or 5%. So we need to do more, indeed.
Great. And finally, over to you, David. Thank you very much.
Yeah, I saw Agnes had asked a question around coverage rate in boys and girls, and actually this is a really interesting point. So when we ran the campaign, the vaccination rate for females in the UK or England, the UK sometimes used interchangeably in sort of coverage rate examples. In around 2014, the girls' coverage rate was about 88%. When our campaign was successful, the girls' coverage rate was at around 83% in 2018, 2019. Since the expansion of the program, we've had the COVID-19 pandemic, and one of the big issues was around the school program is that people weren't at schools. So running these programs was very difficult for a period of time. And in 2023, 2024, I think the boys' coverage rates was around 67%, and the girls was at about 72%. So we now run a one-dose program in the UK since 2023, I think was when we first introduced that. So coverage rates have come down, and there's a myriad of factors at play as part of that. But one of the sort of big takeaways here is that we talk about a lot of the modeling is based on cervical cancer elimination is based on vaccinating a minimum of 90% of girls in order to eliminate the virus. And the UK is an example actually of a country that's had a program for a long time. It's nearly 20 years that girls have had the vaccine available to them. But it shows why it's important to vaccinate boys as part of herd protection. So actually, for many countries, achieving a 90% rate could be incredibly challenging and potentially unrealistic, whereas a 70% rate or 75% in boys and girls, not only could that be more feasible or realistic in terms of elimination of those cancer-causing strains of the virus, we will then eliminate those HPV 16s and 18s at around 70 to 75% coverage. So that is a reason for adding in around boys. So your second point very quickly about how to increase uptake, I think Peter and Momchil sort of touched upon it a little bit. There's no silver bullet as it were, and what might work in one country might be different. Peter spoke about how in the majority of countries, school-based works very well. Portugal being an example of they don't have a school base and have very high coverage rates. So that country context is very important. I think when we look at increasing coverage, it always comes back to who are the trusted messengers in your community. Typically, healthcare professionals, healthcare workers play a significant role as part of that. If there's a school-based program, that tie up, that link between education departments and health departments is really critical. Is everyone on the same page and advocating for as part for this preventative tool? And then the final bit would be around sustained communications. It cannot just be that the importance of this intervention is only communicated on a one-off basis. There are new parents, there are new people reaching an age where they should be vaccinated. There are new people entering the workforce who will be administering these vaccines, who need to be educated. So that is a constant process as well as part of these prevention
And
efforts.
David, just very quickly, a question about what about males who are not vaccinated as boys in terms of our advocacy on that? I know there's a big debate also generally around adult vaccination, but do you want to say a quick word on that? I realise that
Yeah, I mean, vaccinating of males and females, life course immunization, I think, is the sort of term that's used. We are seeing more information around actually human papillomavirus. The clue's in the name. If you're a human, you're at risk of getting the virus at some stage in your life. The reality is that the older you are, the more likely you are to have been exposed to a strain of the virus. So potentially that vaccine is less effective. That's why we want to vaccinate people prior to sexual contact. So typically
Fantastic.
when they're younger, around 12, 13 years old.
Brilliant. And just to identify a really helpful paper from Andreas in the chat around the work that they've done specifically in Cameroon on increasing uptake and gender neutral vaccination. So we'd encourage all of you to look at that. And just to reiterate that all presentations will be available and shared. There's been a number of questions and comments around that. And a bit of a plug around a webinar that we ran last year specifically on HPV prevention for GBMSN together with the International Lesbian and Gay Association. So you'll find that on our website, and I posted on the chat. We've now come to the end of the formal conversation. Just a couple of final words from me, and I appreciate you all just bearing with us. Thank you so much for the really helpful inputs, and thanks to our fabulous speakers for all their insights and all the lessons. And I think we will definitely keep this conversation going, particularly throughout this year, as advocacy for HPV policy change is critically important for us to leverage the developments. And so what's coming next? What do you expect? Please do sign up for our newsletter. There will be a link going in the chat if it hasn't already. You'll get information about our future events and activities and can continue this conversation. We have a call to action that many organizations on this call have already endorsed, but if your organization hasn't, please do endorse at the link that you see on the slide, www.endhpvglobal.org. We're excited that an academic statement on routine universal vaccination that we have co-authored with an eminent group of experts on HPV policy change will hopefully be coming out soon to help to add to the overall call for this shift in global and regional and national policy. We'll be developing guidance this year for countries, particularly thinking about the challenges that have been raised by many of you of low and middle income contexts to really support that shift amongst governments and policymakers. We'll continue to do our advocacy, building on the support that you've heard for the UN Political Declaration and others. Please do work with us if you can on HPV Awareness Day on the 4th of March this year, where we really want to ask the global community what comes next after the UN Declaration on NCDs and mental health. As I said at the start, the first ever declaration to specifically call out for boys as well as girls. And we'd love to have that conversation with you. There'll be things that you can post on social media. As part of that, we'll be producing a two-pager that you could use to advocate to your governments. We would really like to raise the profile of this question on HPV Awareness Day. So watch this space for more information and do partner with us. This is a great opportunity to leverage this unique and first ever political declaration that the majority of the countries around the world signed up to. Look out for our next webinar, which will be in World Immunisation Week in late April. Thank you to our existing call to action endorsers, and please do add your name, as I say, if you have not already. And finally, please do evaluate this website. Your feedback and experiences are really important to us. And there's a question specifically on this evaluation around your own experiences and learning on advocacy around HPV policy change. And we would love to leverage and use your experiences. And by the way, we will share not only the presentations, but all the resources that have been shared on this webinar when we post it out after the event. So thank you. A huge round of applause to our fantastic group of speakers. Thanks so much for joining us today. Enjoy the rest of your day wherever you are, and please continue to do the great work that you do to make the world a better place for all the men and women and everyone, to beat cancer for everyone. Thank you so much.
Thanks, everyone.
Thank you. Thank you very much. Bye-bye.
Bye.